welcome to join the session here, or maybe you will watch the recording here. So, David Hanauer is a physician as well as informatician, so specialized and have lead a team to develop a novel and useful application named EMERSE. It's like an electronic medical record, and it's help and deploy the natural language process. So here in our founding conference, we're just here to invite David to share his experience and in clinical practice. So it's good to invite David here. So David, how about introduce yourself, and I will give the access for you. You can just share your screen. Okay.
Great. Well, thank you very much for inviting me. I really appreciate the opportunity. It's always fun to be able to talk about the software that our team has been working on. And maybe someday some of you might be interested in trying it yourself, and we will be happy to work with you and help you to do that if that ever becomes an interest of yours. What I thought I would do is I'll share my screen. I'll start out with some slides and just go over some background. And then I'll actually go into a live demo of one of our demonstration systems to show you what we've been working on and what is going to be available soon someday. And I would also say this looks like a relatively small group as far as I can tell. So I would invite any of you to interrupt me and ask questions at any point along the way. How does that sound?
Okay.
Okay, great. Well, thank you very much. And I'll just get started with the presentation. Just so you know, some of my contact information is here. My email is at the bottom left of the screen. Now, the other thing I should also mention is that these slides are not available yet, but later today, I will upload them to our website, and the slides will be able to be found at the link that's at the bottom right of the slide. And they're not there yet, but I'll upload them soon so that you can download them at any point. A couple of disclosures. I do have some funding for our work from the National Institutes of Health, including the National Cancer Institute and a group called NCATS, the National Center for Advancing Translational Science. And through our university, they also license some of our work that is known as the EMERSE synonyms to other institutions and private companies as well. So I'm here to tell you about the EMERSE system. And the reason that I'm excited to tell you, and the reason that we're really trying hard to let people know, is that there was a study out of the University of California, Irvine, about 2 years ago, where they interviewed various people who were using EMERSE at our site in Michigan and other sites around the country. And what they found was that users unanimously responded that they would recommend the system to others, and for a tool they found so useful, they believed that far too few people, both within and outside of their network, knew about the tool's existence. And that's just the fact is that many people just don't know about this, partly because we're not a business that has an advertising arm. So we just try to let people know about things when we're able to, like talks like this. And we just hope that through word of mouth, other people will let their colleagues know about the tool and let them know that it's available to use. So probably one of the most important things is that our tool, which is called EMERSE, is meant for unstructured or free text data. Things like where it says Mr. Lee is a 56-year-old male with a history of hypertension, where it actually has some abbreviations, hypercholesterolemia, and type 2 diabetes mellitus, who comes to the clinic today with a 3-day history of dizziness and severe headaches on the left side. Our software is not meant for structured data. Structured data is really the kind of data that easily fits into columns of spreadsheets, things that are in many ways easier to extract because it's already coded, usually coded in some way, and much more easy to work with. So our tool is really meant for the very complex free text data and not for the structured data. And it's been estimated that about 80% of the data within the electronic health records, or EHRs, are in this unstructured free text format. So even though most researchers or clinical people, those who do quality improvement work, use the structured data, most of the data and the details are actually found in the unstructured data, but they just don't use them because it's so difficult to use. So that's actually why we designed this EMERSE system. We really call it a system for the people. It's really meant to be for users. The users are non-technical. They don't know how to code, and that's what you usually need to do for natural language processing systems. The users can search the clinical notes on their own, so they don't need to wait in a queue for an analyst or a data scientist to help them find information. Many times people have very simple needs. They just want to find which patients or which notes mention certain terms or phrases so they can then do more work. And right now, without a tool like EMERSE, it's actually pretty difficult to do, often time consuming and very expensive. And the other thing we do is we're not over promising what our tool can do. We realize it's one of many different tools that people can use. We do expect that user interaction is required, so you don't just press a button and then all of a sudden all your data appeared in a coded format. We really want people to look at the information in the notes to understand the nuances and really what it's describing. But it's also a tool that's meant to be for the admins or the administrators, the people who actually have to run the system. We've designed it to be enterprise grade, easy to support. The idea is that you would install it once at an institution, and then you give out accounts to people so that when you give out these accounts, so that you only have to have it once. You can keep the data central and secure. You can configure the system with what are called roles and privileges to control access. So different users can have access to different pieces of the system or different kinds of documents, different patients. The data are kept secure in a centralized and audited system. Audited is important just because sometimes people want to know, or others want to know, which users were looking at which information. And we also, because it's in this system, you don't have to download the data and store it elsewhere. It's always kept within the system. So there's not copies of the data being stored elsewhere. Oops. So with EMERSE, you can do things like find cohorts based on anything mentioned in the notes, diseases, drugs, symptoms, or really anything. As long as it's mentioned in some way, you can use this system to help you find it. It's really better for more rare things, simply because if you're trying to find a cohort and something is mentioned millions of times for millions of patients, it's really hard to narrow that down unless you have other kinds of criteria to help you do that. So it's been used, for example, for rare cancers. One of them was something called cutaneous leiomyosarcoma, where there was really no billing or ICD code that was specific for that. And so we actually have a talk that we have recorded here, and the link is on this slide. And again, the overall slides will be available on our website shortly after my talk, hopefully. And this was a talk about how they use the EMERSE system to improve research involving rare cancers. The other thing it does is if you're doing a chart review, it will highlight all the terms you're looking for in the notes themselves or in the documents, which really helps with chart review because some clinical notes can be very, very long. And this basically shows you everywhere it found what you were looking for to help you figure out where in the note you need to be reading. And this is sort of based on our philosophy, where we think it's really important to see the terms or concepts in the context of the original text so that you can truly understand the clinical meaning and the context of what the term was mentioned in. And so what I'll do just to show you what I mean here, and I don't expect you to be able to look through all of this very quickly, but this is the output of a natural language processing system. This one is called MetaMap by the National Library of Medicine here in the US. And it's not that it does a bad job, it finds lots of information, but when it outputs the information in this kind of format, it can be kind of difficult to understand what was actually happening with the patient because it's a lot of clinical details, but the other context of the actual the language is kind of missing. So that can be difficult. Another NLP system gave the output in this kind of format, which is probably a little bit easier to read, but it still may be very difficult to understand exactly what was happening. When I look at this, for example, I see the words breast carcinoma, lumpectomy, and later on I see other things about tuberculosis. But what isn't really clear here, that's harder to understand just from this kind of output, is that the actual case was that a patient was thought to have breast carcinoma or breast cancer, but then after further examination, it was found out to be tuberculosis. And so this is the original text. The other things I showed you were the exported details from the natural language processing, but that makes it more difficult to use. So we want to sort of incorporate that together so that users can have the benefits of the NLP and searching, but while still seeing the original note. EMERSE is also very fast. The reason it's fast is because we build what's called an index of every single word that is in all the notes. So it's a very large index, but that makes it fast. And so we tried this several years ago where we asked our reporting team that normally looks at the electronic health record data, and we asked it to search for some things. One of them was cavernous hemangioma. And when we searched it with our typical database, it took about 7,000 times longer than when we searched with EMERSE because of the index that we built. And that just means that you don't have to wait several hours or even a day or so for a result to come back. You can get your result within a few seconds. If it's not what you were looking for, you could then try it again and again and again to really refine what you're looking for and get the information or the notes that you need. Another thing that we have is something that we call synonyms. It's used for what's called query expansion. So that if you type in one word or phrase, it will suggest other words and phrases so that it can help you expand out the kinds of things that you're looking for. So you can include multiple data sets. So we have a default one that we have been building for many years. But if there's other data sets that you're interested in, it's very easy to format to include in the system. And we've actually done that for multiple data sets already. The one that we provide has many different things in there: acronyms, abbreviations, professional and consumer terms. So that would be something like a professional term might be myocardial infarction, and a consumer version of that would be heart attack. We have misspellings, trade and generic drug names, chemotherapy regimens, and it goes on and on from there. And what we found is that a lot of these entries that we've been including are not found within sort of more formal vocabularies or terminologies. So when we check this against what's called UMLS, the Unified Medical Language System, about 85% of what we have is not found in those formal kinds of terminology systems. So a typical workflow of how someone might use the EMERSE system is that they would usually start with identifying a cohort of patients they want to look for. This might be from a structured data tool. So many places have structured tools. Some of them might be something like the I2B2 system, or they might use EMERSE itself with our find patients function to find patients that mention a certain term. Once they have a cohort, they'll often try to abstract additional details from the text using the EMERSE system, and then they will store it in a data capture system. One of the most popular ones for us is REDCap, and I think that's actually being used all over the world. In terms of research publications that have used the system, we've identified about 620 papers and abstracts that have used the EMERSE system. Oftentimes, people who use the system don't cite it, so we don't really have any good way to track it. And the full list of publications is on our website as well. So where is EMERSE right now? Well, it's mostly in the US. We do have one site in Europe that's running it at the moment. And then we have some places with the yellow pins that are installing it. At one point, I think there actually was a group in Taiwan that was working on installing it. And I don't know if that's on hold or not, but I didn't put the pin there because I wasn't sure if that was continuing or not at this point. And then this is just sort of zooming in on the US of the places where most of the instances of the system are running. So the EMERSE Research Informatics Network is something that is actually built into the system, but isn't really turned on by sites yet. But what it does is it allows for real-time, secure cross-site queries from one system to another. The reason it's secure is that it doesn't ever send patient identifiers or patient information or even the free text from site to site. What happens is you would query the system for some term or phrase, and then it would query the other sites, and the other sites would return back an approximate count of how many patients are in each system. And that would be to help do things like estimate a cohort of patients, especially for a rare disease where there may not be many patients at each site. But if you could work together, you might be able to get enough patients for an interesting study. And this is just showing roughly what a screenshot of that would look like. I've just blocked out the patient counts here, but we had done this experiment once with the University of Kentucky, where we could search for renal cell carcinoma, and pretty quickly it would just build up a table that just showed roughly how many patients were at each site with renal cell carcinoma. Another exciting thing that we're working on, we're getting much closer to releasing this to all of our users, is the incorporation of natural language processing, or NLP. This is incorporating concepts like, or annotations like negation, where it says maybe the patient does not have something. Uncertainty, that might be where it says the patient might have something, or probably, or could. Subject identification, so this would be whether it's about the patient versus somebody else, like a family member. History of, that would be whether it seems that it's about what's currently happening, or maybe it's just something they've had in the past. And then also what we're calling named entity recognition, or mapping to ontologies, where many different clinical concepts are mapped to specific concept identifiers that can be then used later on to map to other vocabularies or ontologies like ICD or RxNorm or whatever people would be interested in. And this is just a screenshot of one of our proof of concept systems showing how this natural processing could work, where the term serous carcinoma in yellow is what a user has typed in and searched for. And some of these other things, let's say the ones that are underlined, which are procedures, are with a dotted orange, are pre-identified using the NLP, so users can choose to turn those on or off in terms of the highlighting. And then, for example, the parts underlined in the pink color are negated concepts, where it says has no history of, etc. And if I get to our demo system, I can show you a little bit more about how that works. A lot of our information can be found at project-emerse.org. That's our website for our user guide, some videos, information about how to install it, our documentation, things like that. We do have a Twitter feed, which is Project EMERSE, where we will tweet about publications, software releases, announcements, and other things that are coming up. We don't use it too often, but we do use it sometimes just to announce things. If you're interested in learning more, feel free to contact us, and I think our email is on the next slide. We can schedule time to talk with your team about research strategies of using EMERSE, training. We can give live demonstrations, so if your team is interested in seeing it, we can give a demonstration and show you how it works, and that way it might help convince others to try to install it at your site. And then our team, we actually have a pretty small team, but I just want to thank and acknowledge them. It's Lisa Ferguson, myself, Colin McLean, and Guan Wang. They're all part of our team. And our email, our generic team email address is emerse-team@umich.edu. And that's the end of the slides. And again, I will upload these slides to our website hopefully later today. So if any of you are interested in downloading them, you can reuse them, you can share them with others, or do what you want with them. And I'll stop for now to take questions, and then after that, I can get into a demonstration. Any questions at the moment?
Maybe we can just help them to answer in your community meeting. Okay.
Sure.
Go ahead.
Yeah. Okay, so right now I'm sharing the screen for one of our demonstration systems, and this one is not quite ready for release yet. We're still making some changes and fixes, but this is kind of showing how this can now work with the natural language processing built in. Now, I'm not going to show you all different aspects of this system because it does a lot of other kind of management features, but I thought this would be useful to show you. So this is kind of the main interface where there's sort of 3 different things that you can enter. You can enter which patients you want to look through. Now that could be all patients. In this demonstration system, we have 10,000 fake patients. In our real system at Michigan, we've got about 3 million patients. Filters would be what kind of filters you want to put on. Whether you want to filter by source or by other kinds of metadata about maybe the clinical service or the kind of clinical note it is. So there's, and then the terms is where you would actually enter the information. So let me just show you that here. I'm going to type in something simple. I'll type in lymphadenopathy, which are sort of enlarged lymph nodes. So I'll add that term. And then it's actually what I'm also going to do is I'm going to go to a saved patient list, just 16 patients, because it works well for a demonstration. These are not real names. There's not real notes. This is all just fake information. So since I've now picked my 16 patients, I'll now highlight these notes and let's see what we get here. So for example, I can see where it talks about in the note, I can go down and it highlights where it found it. So it says stable regional lymphadenopathy. The top here is, let's just see, we go to another one. Go, what did I just pick? Yep, oh, that was one I already picked. Here it talks about right-sided lymphadenopathy, right? So I can find those kind of things easily. But if I keep going along here, I can maybe find this one where it's clear that it says, let's see, further down, she had no lymphadenopathy. There were no ascites or lymphadenopathy. So this is where we talk about this idea of negation. So before I even get to that, I'll just show you up here. This is kind of where some of the other information is about the patient. So this tells me who the patient is and their medical record numbers. A comment could be just something that I want to store about the patient, like this patient does not have lymphadenopathy, spelling that wrong. A tag could just be whether you want to record it for, maybe they're eligible or not eligible for a study, whatever you want to use it for. Down here, this is where we have other kinds of details about natural language processing, and I can collapse certain sections if I want to make this more available to see the note. If I scroll like this, that disappears. If I want to stick it to the top, then what happens is then that part stays at the top so I can see it more. And I can click on things like, let's say, anatomy. And if I click it once, it sort of underlines in a light sort of tan color. And if I click it again, it will highlight that. Or I can click finding. So these are all the natural language processing components, disorder, and they can highlight those things and I can go from there. So this is just showing me the kinds of things that I might find. So for example, and this is all from the natural language processing. Let's see here, what should I show you? So for example, down here where it says immunohistochemistry, I can click on that. And because this is a natural language processing found component, I have a code for it. That's what's called a concept unique identifier. So it can find these codes for all these different sort of terms, alkaline phosphatase, examination, tumor cells, found tumor cells, and it's showing the code for all of those. Now, the other thing I can do here is I can turn on to see where it found things like negation. So if I click negation, and I can actually turn that part off, it's now underlining everything it thinks is negated. So if I go down, you can see here where it says had no lymphadenopathy or no ascites or lymphadenopathy. Those are underlined as negated. So the system is recognizing that they are negated. So what I can do is I can go back, and I can go back to where I have this term lymphadenopathy. And for negation, at this point, it says find any mentions regardless of negation. So what I'm going to do now is I'm going to say find positive mentions only. So that's basically saying don't find those negated terms. And if I go back, and now I highlight my documents again, if I go back to that patient for Vivian Price, I don't find anything there now. And I forgot to mention actually that what I'm showing here is a table where every row is one of the patients. and the columns are different document sources. And this is configurable for each site. So every site would have different sources of documents. They set it up the way they want. And for example, where it says 1 of 19, that would mean that 1 out of 19 notes mentions lymphadenopathy, and in that case, in a non-negated form. So if I go back here, I think it was this, I actually forgot what note it was. It's no longer highlighting where lymphadenopathy was. Let me just show you that again. I'm going to do it with a different example. I'm going to type in hypoglycemia, which is low blood sugar. Hypoglycemia. Okay, I type in hypoglycemia, and I'll do my search. I'm actually going to change the color so we can make it stand out better. We'll make it sort of green color. I'll choose highlight documents, and let's see, where can I go here? Okay, here, in pathology. So what we can see here is, I can see where it talks about episodes of hypoglycemia, but then below there it says without documented hypoglycemia. I can see another place where it says without documented hypoglycemia, but another spot where it again talks about hypoglycemia. So now it has a mix of terms that it found and terms that are not negated and terms that are negated. So again, if I want, I can say, let's go back to this. I can say only highlight the negated ones. So I'll go to this, I'll say highlight negated mentions only, and I'll hit done, and I'll go back. And now you can see the only ones that highlighted were the ones that are underlined that are negated. I can go back and I can change that. I can say, you know what? I want to highlight only the positive mentions. And now if I go back, you can see here the ones that were underlined before, or that ones that are negated are no longer highlighted. And so that's kind of how we can do those kinds of searches. Now, a few other things that we can do here is I can do combinations. So I can say ALL treatment. And if I do this, and I'm going to do what's called a proximity search, I'm going to look for ALL and treatment within 5 words of each other. So I'm going to do that. I'm going to highlight my, I'm going to change the color so I can make it stand out better. Okay. All right, so when I look at this, I can see things like, let me just hide all these, all attenuate the treatment. And in this case, this ALL is not what I'm looking for, because what I was looking for was the acronym acute lymphoblastic leukemia. Actually, the other thing we do here is I'm going to turn on what's called the mosaic mode, where it's going to show me the colors of what it found, so I know exactly where to look. So I'm looking here for what's the light blue color. So let's see here. Yep, treatment, whereas all, right? That's not the right thing. So I'm going to go back, and I'm going to modify this, and I'm going to say, I want the ALL to be case sensitive capitalized. So I just toggle that, and now it's a little bit bold just to help me identify that it's going to be a case sensitive search for the acronym acute lymphoblastic leukemia. And now if I do this again, and I go here, now I find the right kind of thing I'm looking for. So this is now finding things like ALL protocol, treatment for pediatric T-ALL. Now that's getting me to the right kind of one I'm looking for. Okay. I'm not going to go too much further here, but let me just show you a few other things you can do. You can also search for concepts. So I mentioned this before. So a concept might be something like C0686619. Hopefully I got that right. Change the color. And now I'm looking for this concept. What the system is doing, it has a little light bulb there to show me that it identified that as a concept. And now when I look here, that is a concept for lymph node metastases. And so I didn't put the term and I put the concept in, but now I can find that lymph node metastases, and I can find that by concept. Another example might be this one called C0220650. That is malignant. So the official name of it is metastatic malignant neoplasm to brain. Let's see here. Oh, here's one. So it found brain metastases. So that's how we found that. And you can actually mix and match these. So what I'm going to do here in this example is I'm going to type in C00000737 and the word left. Okay, so that is a concept for what was that for? I think it might be abdominal pain. And what I'll do is I have those two terms. I'm going to put on that proximity search so I can find it near each other. And so now it's going to look for the concept and the word left within 5 words of each other. So I do that, and let's see what we get here. Yep, we have left-sided abdominal pain, left-sided upper quadrant abdominal pain. So again, I'm finding some things by concept. I'm finding some things by terms. We can mix and match all these. We can even mix and match different concepts together. So I can go back here and I'll type in 2 concepts, C0008031 and then C00134. I'll make that a blue color. And again, I'll turn on my proximity. So I'm searching now for 2 concepts close to each other. I actually forgot what these concepts are for, but we'll find out in a minute. I'll choose highlight, and let's see here. I'm looking for that dark blue color. Chest pain and dyspnea, so difficulty breathing. So I can find chest pain, dyspnea there. If I go back, I can see another example here, chest pain, shortness of breath. So again, you can search by these concept identifiers, which could be kind of useful for sort of standardizing your search, especially for research projects. You can search by the terms. You can mix and match. You can get all this natural language processing in there. And then it's meant to be just a really simple system for users to be able to work out what they want without having to go to a technical expert. So I think with that, I'll probably stop. This demo system is not fully complete yet. As I mentioned, we're still doing work on it, but we do hope to be able to release this to the public, hopefully over the next few months, and then we'll start to get more people trying out these features and giving us more feedback. So I think with that, I'll stop. I can show more about the system here if people have questions, or I can just answer questions in general. So I'm hoping you can all still hear me. I'm not sure if you can or not, but if there's any questions, I'm happy to answer those now.
Okay, so thanks for your demonstration.